Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. In today's video, our fourth vaccine update and the Johnson & Johnson vaccine gets FDA emergency use authorization. How it works and what this means. So please share this with someone you care about. This vaccine was developed by the Janssen division of Johnson & Johnson. It's referred to in many ways, but I'm going to refer to it as J&J. This vaccine uses a different mechanism compared to the two mRNA vaccines we already have, Pfizer and Moderna vaccines. If you want to know more about how those work, go to YouTube and search for the Daily Pandemic Update with Dr. Mark Jamin and look for video number 113. The J&J vaccine uses what's called a viral vector platform to deliver the genetic code that causes the cell to make a copy of the spike protein like what resides on the surface of the SARS-CoV-2 virus. And it is this spike protein that the immune system responds to, just like the other two vaccines. It's just a different way to get it there. The virus used is one that is not dangerous, and it is further rendered harmless by no longer being able to replicate. And in this case, they use an adenovirus. That's a common cold virus, and it merely transports the code. The viral vector platform has been used in vaccines well before, so it is a well-known mechanism. The phase 3 trial included nearly 44,000 participants across 8 countries in 3 continents, and that included South Africa and Brazil, 2 places where the variants had already emerged. A third of the participants were over the age of 60. It was across diverse groups, and 40% had high-risk comorbidities for COVID. And it was found to be 67% efficacious for mild to moderate symptomatic illness, 72% in the U.S. arm of the trial, and it was reported to be 85% protective against severe illness. It was also reported to be 100% protective against hospitalizations and death up to 28 days after the dose. Now, there are a few things to note here. First, I can't find anything that reconciles a 15% risk of severe disease with no risk of hospitalization, since severe illness is what usually results in hospitalization. Second, the endpoint was at 28 days, and if the timeline goes out farther, will these results hold true? Third, whether or not a vaccinated person can still transmit the virus is unclear, although in a small subset in the trial, it did appear to reduce this by about 70%. It's not 100%, but that would be substantial if true, and we'll see if this persists. Now, some want to compare this 67% efficaciousness with the 94 to 95% findings for the other two vaccines, but this is really not an apples-to-apples comparison. For one thing, unlike the first two vaccines, the J&J vaccine was tested when the variants were already around. The important thing here is that this vaccine is very effective for the worst outcomes, and it does not require cold storage needed by the mRNA vaccines. It is a single-dose vaccine currently because this is how the study was designed. But J&J is also trialing a 2-dose regimen to see if this prolongs the immunity. So stay tuned. There may be a second shot booster recommended in the future. It was tested in those over 18, and it's currently being tested in ages 12 to 17. And pregnant women were not included in these trials. Adverse reactions were similar to the Pfizer and Moderna vaccines. There were no severe allergic reactions during the trial initially, but since 2 have been reported right after injection. So like the other 2 vaccines, this would make for a rate of serious adverse reactions that is super low. So what does this mean? Well, we now have a third viable vaccine. This will dramatically increase the supply and accelerate the process of getting people vaccinated. All 3 are efficacious. All 3 will do the job. And when you hear experts say take whichever one you can get, well, that's correct based on what is known as of right now. Will there turn out to be differences as we learn more? Perhaps. But right now, the more protection there is in the community, the harder it is for the virus to find another person to jump to. And that has to be our aim right now. The less virus around, the less chance for variants to emerge, and the more effective our efforts will be to get to a time when we can all safely gather together again. So be well and be careful, especially right now.